How is bipolar disorder diagnosed? What does bipolar disorder feel like? What is the difference between bipolar 1 and bipolar 2 disorder? What is mania and how is it different from hypomania? Let's talk about this. A common question people ask is, do you need a special test to be diagnosed with bipolar disorder? The answer is no, you don't. Bipolar disorder is a clinical diagnosis. What this means is that you can be diagnosed with bipolar disorder based on the symptoms you're experiencing. And I'll talk about this in a bit. Note that this video is to help you understand what bipolar disorder is. It is not to help you diagnose yourself. If you think you may have bipolar disorder, you should see your doctor or a mental health practitioner for an evaluation. So you don't need a brain scan or a blood test to be diagnosed with bipolar disorder. Diagnosis is made by a qualified mental health practitioner. When you meet with a mental health practitioner, you go through a series of questions which we sometimes refer to as a psychiatric assessment or a psychiatric evaluation. The rationale for this psychiatric evaluation is to determine what symptoms you're experiencing and if they meet the criteria for bipolar disorder. These symptoms are based on the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-5 for short. Mental health clinicians use the DSM-5 to diagnose psychiatric disorders. Bipolar disorder can cause dramatic shifts in mood, energy, and activity that affect your ability to carry out day-to-day tasks. These energy levels and mood shifts are usually more severe than the regular ups and downs we all experience. Bipolar disorder can initially present as depression, mania, or hypomania. What this means is that you may initially be diagnosed with depression and treated as such for many years before you develop a manic or hypomanic episode. In this case, your diagnosis will change from unipolar depression to bipolar disorder. According to the National Institute of Mental Health, about 4.4% of US adults experience bipolar disorder at some point in their lives. This incident rate makes it important to diagnose and treat this condition properly. Diagnosis involves a psychiatric evaluation which aims to assess a person's mental health status, diagnose a mental disorder, and confirm if psychiatric treatment is needed. This evaluation usually starts with a description of the symptoms you're experiencing. It is essential to highlight the various symptoms, the timeline, and the severity of the symptoms. Your mental health practitioner will want to know if you have or previously had a depressive episode. I talked about the symptoms of depression in a previous video. Your mental health practitioner will also want to know if you have or previously had mania or hypomania. Suppose you don't have or never had a manic or hypomanic episode. In that case, you do not have a diagnosis of bipolar disorder. Let's talk about mania and hypomania. We'll start with mania. So what are the symptoms of mania? According to the Diagnostic and Statistical Manual of Mental Disorders, mania is defined as a distinct period of abnormally and persistently elevated, expansive, or irritable mood, and abnormally and persistently increased goal-directed activity or energy lasting at least 1 week and present most of the day, nearly every day, or any duration if hospitalization is necessary. Now let's simplify this. The key words to note here are abnormally and persistently. This means your mood, activities, and energy levels are abnormal and persistent. We're not talking about just being happy or in a good mood. Instead, we're talking about extreme happiness, irritability, energy levels, or grandiose ideas that are way over the top. So much so that family and friends around you notice it because it looks abnormal. This obviously will present in different ways for different people. An example may be someone who suddenly comes up with a new idea that he can build a better search engine than Google in 1 week. He has no tech background, but is convinced he only needs a few days and needs to enter his savings to get started on the project immediately without any research. Or someone who has never played basketball But buys a ball and practices non-stop for 3 hours daily, saying he's the best player and needs to go professional immediately, even if he's 55. Yet another example is a man who dresses conservatively, suddenly switching his fashion style and showing up in a yellow shirt, orange pants, and green shoes. Or someone who stays up all night writing 20 pages of a letter he has to mail to the president on a topic he does not know about. These examples may require a lot of energy to keep up with. When you have mania, your energy levels can increase dramatically. You may go on for days not sleeping at night or sleeping minimally because you have these grandiose projects you must work on. Now, it is essential to remember that these manic symptoms have to last at least a week and not just a few days. Also, during the period of elevated mood, increased energy and activity, you must have at least 3 of the following 7 symptoms. If your mood is only irritable, you must have at least 4 of the 7 symptoms. These symptoms have to be present to a significant degree and represent a noticeable change from usual behavior. The first symptom is inflated self-esteem or grandiosity. This is an abnormal inflation in how you feel about yourself. An example is feeling you're the most powerful person on earth and can influence any part of the world you choose because of your special powers. Decreased need for sleep. This may present as going for a few days with 0 sleep or feeling rested after only 3 hours of sleep. This differs from burning the midnight oil because you have an exam or a work project deadline. With mania, you may be awake, cleaning your house up to 4 a.m. and still have the energy to keep going. Know that this pattern has to be unusual and abnormal. So suppose you're preparing for a big exam and have been starving yourself of sleep to get a lot of studying done. In that case, this is not unusual and does not count as a symptom of mania. More talkative than usual or pressure to keep talking. Some people are more talkative than others, but with mania, people may find you overwhelming and intrusive. Your speech may come across as disturbed and disjointed. As your mania worsens, your speech may become more rapid, louder, and challenging to interpret. It may be filled with puns, jokes, rhymes, and other irrelevant statements. Flight of ideas or subjective experience that your thoughts are racing. With mania, your thoughts can be going so fast in your head that they appear disjointed and can become overwhelming as you cannot keep up with the pace. This can make it difficult for you to think straight as you feel like your mind is all over the place. You may appear distracted and disorganized because your mind is going at 1,000,000 miles an hour. Distractibility. Your attention is too easily drawn to unimportant or irrelevant things around you. Your family and friends may point this out because it is obvious. Increase in goal-directed activity. This can be socially, at work or school, or sexually. You may have psychomotor agitation. Psychomotor agitation is purposeless, non-goal-directed activity. This means that you may be fidgeting a lot while sitting or pacing around aimlessly without accomplishing anything. You may feel unsettled and restless, but find it difficult to slow down or contain yourself. The 7th and last symptom is excessive involvement in activities that have a high potential for painful consequences. This can include going on buying sprees, sexual indiscretions, or foolish business investments. You'd agree that going out to buy 4 brand new motorcycles simultaneously when you don't know how to ride one will be considered excessive. Or racking up all your credit cards to purchase clothing and shoes for everyone on your street. To meet the criteria for mania, these symptoms have to cause a marked impairment in your social life, school, or work, or it requires admission to a hospital to prevent harming yourself or others. Or there are psychotic features like hallucinations or delusions. Manic delusions are often related to great wealth, extraordinary abilities, or power. In some cases, they're just bizarre. The last thing to note about mania is that the symptoms you experience are not as a result of medications, illicit drugs, or a medical condition. So this is mania. Let's talk about hypomania. Hypomania is similar to mania, except for a few differences. A hypomanic episode presents with the same symptoms of mania, but lasts at least 4 days, instead of 7 days in mania. Also, hypomania does not affect your functioning as much as mania does. This means you could be hypomanic but still go to work or school and interact relatively well socially. Because these behaviors are uncharacteristic of you, people around you will still likely notice something unusual about your mood, your energy, and activity levels. But it is not as severe as mania. You don't end up in a hospital, and you do not develop psychotic features like hallucinations or delusions. Note that if you develop psychosis, then you have mania. Mania or hypomania is usually evident because of the way it presents. There may be lots of excitement, high energy levels, talkativeness, sometimes amusing, and frequently hyperactive. There might be irritability with low frustration tolerance. Mania can cause emotional lability, switching from laughter to irritability to depression in minutes or hours. It can present with rapid speech, racing thoughts, delusions, hallucinations, impulsivity, and poor judgment. People who are manic are notoriously unreliable in their information because lying and deceit are common in this condition. If you're manic, likely you do not realize that your behaviors are abnormal. This is what we describe as a lack of insight. So what's the difference between bipolar 1 and bipolar 2 disorder? If you have a manic episode, you have bipolar 1 disorder. If you have a hypomanic episode, your diagnosis is bipolar 2 disorder. With bipolar 1 disorder, you may subsequently have hypomanic episodes even though you previously had a manic episode. In this case, your diagnosis remains bipolar 1 disorder. Bipolar 2 disorder presents with hypomania, but you could end up with a manic episode or with psychosis. In that case, it means your diagnosis will change from bipolar 2 disorder to bipolar 1 disorder. So bipolar 2 disorder could change to bipolar 1 disorder, but bipolar 1 disorder always remains bipolar 1 disorder. A study showed that over 80% of people with bipolar disorder had serious impairment. This is the highest rate of serious impairment among mood disorders like unipolar depression, cyclothymia, or dysthymia. This makes it important to treat this condition properly. In terms of treatment, bipolar 1 and 2 disorders are treated similarly. I'll discuss treatment in a future video. Thanks for listening.